Hello, welcome to the Mentor Maya platform. And I'm Margaret Tambe. I'm the host. And I am excited to be here today with so much brains. I have with me 3 medical doctors, and I will let them introduce themselves, and we're going to talk today about pre-medical school, their experiences in medical school and post-medical school. What are the plans? With the hopes of inspiring those who aim, those who dream to become medical doctors in the future. I hope you watch to the end and get as much information as would be possible from our interview, and that it spurs you to get into this field. I'll give you guys a chance to introduce yourselves, and then we'll go from there. You can start.
Hello everyone, I'm Dr. Tambe Bisom Emilia, a year 4, a current graduate from America International University, West Africa, the Gambia. I'm happy to be here today to share the little I know and to inspire you in joining the medical field and helping so much out there. Thank you.
Thank you.
Hello everyone, I'm called Leticia Ako, a 3rd-year medical student in the Faculty of Health Sciences, Boya. I'm glad to be here to share the little I have with you all. Thank you.
Thank you for coming.
Hello everyone, I'm Dr. Obi Besson Florentine, a graduate from the Faculty of Health Sciences, University of Boya 2021. We're excited to be here to share all the information that can be valuable to you. Keep watching.
Okay, thank you. I'm excited all of you are here, so much brains. For my first interview to be dealing with so much brains is something. Now let's clear the air. With the experiences that we have here in Africa and in Cameroon specifically, we've gotten to a point where from our interactions with doctors, we get to a point where we think, or we get to a point where we are tempted to think that doctors stop caring about their patients and they care more about the politics of medicine or the money they make. What would you guys say about that? Do you have any particular training on empathy? And is it true to think that because of the conditions, the economical conditions, your heart have gone from patients' conditions to just being able to make a living? Dr. Besson, what would you think about that?
That's a very tricky question. Concerning the education part of it, during the CTA, we are taught on ethics, on how to treat patients. We are taught about justice, equity, what the laws are, certain laws which we are guided by, and we take the Hippocratic Oath, where we're supposed to attend to our patients as much as possible. It has a lot of ethical principles. So, to say doctors are focusing now on money instead of patient care, I would think it's an individual something, because the core of medicine, there's still more people who are who show a lot of empathy towards patients. So I think to generalize it will not be really fair. I would say it's based now on an individual level, but I can say generally the medical core, patient empathy is still one of the principles we work by.
Okay, all right. That's very comforting to know that. And truthfully, you know, once somebody has one experience, it's easy. The bad news and the bad experience goes wild. It's easy for somebody to get a bad experience and tell 20 people, 30 people. Meanwhile, the good experience doesn't spread as much. So I would think that would be a good assessment. And let's talk about pre-medicine, pre-medical school experience. How did you guys prepare Or at what point did you think that you want to become a medical doctor?
Okay, that's a very interesting question. All right, I, for one, I had the passion to become a medical doctor once I got into secondary school. I can say at that level. Initially, it has always been there all the way, let's say, when I was able to reason now what I want, let's say 10, 11 years old. But it became stronger, so I decided to choose sciences, in school to help me guide, because I had the passion way long ago, Yes, I always wanted to be able to help people, be able to rescue a situation, show that empathy, show that care. So it boosted me into thinking which profession will really help me to do that a lot. And I realized that getting into the medical field can help me do that. So I decided to get into sciences, and thereafter I went to high school. I still did sciences, all the science subjects. Then luckily took the entrance exam and passed, and then started pre-med, which I can tell you the truth is very challenging, because if you don't succeed well in pre-med, that is a foundation, most institutions will not allow you to go further. We had a cutoff grade. You had to have a GPA of 3 in my institution, 3 or 4. So without that, you could not start medicine, So you have to be ready. You have to study hard. You have to, if possible, have groups to study with partners. You have your mates, people make time and do the extra work, so that you should be able to meet up with those grades and then move forward. Yes, so a lot of hard work, a lot of determination, a lot of preparation, and staying focused. But once you're passionate about it, it gives you the push to do all the extra work. So that's it. Yeah.
So what time is pre-med? Is that like the first year?
Yeah.
Or is it before the first year, or is it during the first year of medical school? Is that pre-med? What time is pre-med? What time?
Pre-med, I'll consider once you've passed your entrance exam, you begin with pre-med. In my own situation, in the institution, we began with pre-med. You didn't call it medicine year 1 yet.
Really?
Yes.
How long is that period?
1 year.
1 year?
Yes, it's 1 year. When you successfully had the GPA, the grade that the one, you now begin medicine year 1. Yes, but it's generally not, it doesn't have to be the same. There are other institutions, once you get into medical school, once you pass your exam, you can consider that medicine year 1, and then you do your pre-med and move forward.
Is that the case for Cameroon?
It's not the case in Cameroon.
Okay.
Once you succeed in the medical
Yes.
You start medicine year 1.
First year of medicine.
Okay.
So generally, it's how many years in your medical school?
7 years.
7 years. And there is?
Yeah, about 7 to 8 years. Sometimes it's prolonged, yeah. But, yeah.
But if you pass in all your courses,
Yes,
it's 7
yes.
years. Or
Yeah, I think the institution can delay. Maybe they'll say graduation will come up at this time, and maybe not every student is able to meet up. We can push it a few months ahead.
Okay.
But normally the duration of medicine is 7 years.
7 years.
Yes.
Okay.
Uh-huh.
So how do you prepare, Miss Leticia Agbo, how do you prepare? Tell us, in high school, in secondary school, what subjects? And Dr. Emilia said you have to prepare hard. I taught science, I'm a literature person. For literature, you have to read like a book, or in history, you have to read, you have to memorize. To me, it's a lot of work. But I think people who do sciences, once you have your formulas down, why do you have to work hard? It's a lot of formulas, chemistry and this. Once you have it down, do you still have to work hard?
Okay, thank you so much for the opportunity. Actually, I can say that working hard is not, that's not all about it. You have to study very smart. That's what I can say, because it's not all about writing the formulas down. It's not all about getting all the bulk of work. Sorry, it's not all about getting all the workload covered, because sciences is very much bulky. We have courses, subjects like biology, chemistry, and physics, which you require to know very well, to master, which are also very bulky. Yes, you have to study very hard, but in addition to that, you have to study very smart. Like me, for one, I use various strategies to study. And most of the times I study with questions, past questions, because I knew very well that the field, my dreams require me to have a particular grade, a particular result. Like my doctor just said, the field medicine is very competitive, and just the good ones, the best, my lecturers, my teachers used to say, just the best can get into it. So that was like a push to me. I put in all my best, I put in all my effort to make sure that I was one of the best students during my secondary school years, so that it will make me it can help me to be chosen as one of the students to get for the entrance. I can also say that during the secondary school years, there is a lot to master for particular 3 subjects like biology, chemistry, and physics, including maths, because these 3 main subjects, if you don't have it, you can't get into the medical school. They are like the basis when you are in the secondary school. You need them to register for the concours. I have seen situations in which students register, even because they register before results are out. Students register for the concours, and when results are out, they realize that they do not pass biology and chemistry. So they are put on hold not to write the concours. So the main subject when you are at the advanced level, let me cut it for short, is to have the courses pass the subject biology, is to pass the subject biology and chemistry. Then you can have a bit of knowledge in physics and maths, which will be required when you get into the medical school. And
It's okay.
And to get into the medical school, normally there's a need to pass the concours. That's the entrance exam, which in my lifetime is the most competitive exam I've ever written, because there are a lot of people going in for the exam, the smartest, the best of them all, in all countries, in all schools in the country, in the nation, and even part of Cameroon. So it gave me a lot of that motivations. Like since I had that passion to be in the medical school, to take care of the sick, since it has always been there from childhood, and also I got my inspiration from my mom, who was a gastritis patient. I just had that passion to make sure that I treat my mom. So I'm like, I'm not going to fail her. I'm going to put in the effort. So I can say that to move forward, you need to get something that keeps you going, because there is always a time. There will always be a time in which you feel like you are giving up. Is to keep on pushing, and that's what I did. Undergo a right preparation classes. You yourself need to put in your personal effort. First, they will not teach you everything. You need to put in your best. Revise past questions, review a lot of materials online. We are so blessed because our world now is digitalized. We have so many resources online, so it's easier for us to get in touch with all those materials online. So it's to get into the right preparation group, get the right resources, prepare. That people won't even prepare at home. I am talking for myself because I went through a preparation classes. That people who did not go to a preparation class, but they did so well. They passed so well. So it's not restrained to that. You can study at home and still make it. Let nobody discourage you, especially for those who don't have money to pay for a preparatory class. You might not be privileged to have that money, but you can get the resources and study at home
And
still make it.
Okay, all right. Thank you very much. So I'll ask Dr. Bessem about her school experience. How is the climate at school? Do medical students work together as a team, or you just have a few friends? Do you share resources like books? Do you pass it around for everybody in your class? How is the relationship between students and medical doctors and clinicals? How do they run the clinicals here? Is it easy to have a position for clinicals and things like that? How is the school environment in total?
So, the Faculty of Health Sciences, that's a university I attended, University of Boya. The environment is physically very beautiful, it's very comfortable and nice. So generally the medical school experience, I can say, we can describe it like it went uphill then downhill. During the first year, most of the things you do are things you do in advanced level. You do biology, you do chemistry, physics. Most of the things are similar, it's very easy. Okay. But the second year, as you're going further, it becomes a bit difficult. Then normally the first 3 years are pre-clinical, or just in school, we do not go to the hospital yet. Okay. Then the 4th year to the 6th year, those are the clinical years, that's when you go to the hospital. So I can say the first 3 years there's increasing difficulty, but the 4th year is like the hallmark. It's difficult because you are transitioning between the living from school to dealing with patients in the hospital. So all this while you're going to see patients, and now you have to know how to meet the patient, discuss the patient, consult, class the patient, and so on. So it is quite difficult. That transitioning is quite difficult for a lot of people. Then with the 5th, 6th year, you must have been used to it, and you write the exam and you're done. So about collaboration, I think just like in every university, people form study groups. If you're interested, you can always meet somebody, because it's also a very competitive course. We do repeat. If you don't pass, especially if you live from the 3rd year to the 4th year, if you do not validate all your courses, you don't carry it over. So yes, I think everybody is willing to form study groups. It's just for you to show interest. Okay. They form study groups, share information and so on. Concerning the teachers, since most of my doctors, you rarely see them often. But when you're working in the hospital, then you have the opportunity to learn as much as you want. Yeah, so I think that's it.
So today, the doctors from your school, are they the same doctors that mentor you in the hospital, or you meet new doctors at the hospital?
Okay. Some doctors in the hospital are not teachers. There are some doctors who are not lecturers from the University of Buea. Okay. So there are some of our lecturers that are in the University of Douala. So sometimes we'll go to Douala to do posting, we meet some of our lecturers there. Okay. So almost all the lecturers in school, you meet them at the hospital. Yes. Not all the doctors in the hospital.
The hospitals come to school to teach. Okay. And so you have 3 years of clinicals.
Pre-clinical, yes, 3 years pre-clinical, 2 years clinical. Yes.
And do you have clinical labs in school before that to learn basic things?
Yes, I can say so. We have an anatomy lab where the bodies there that we're supposed to operate and learn and see the things, the bones, everything practically. Then we have other labs about chemistry where we learn some of the things, because like I said, during the first 3 years it's still like opposite somehow, we're just doing general things. So all those pathologies, those small things, looking at the microscope, we have the lab where we learn those things.
All right. And do the older students help the younger ones in like organized ways? Or if the younger ones have questions, they just have to come and ask, or do they have set up groups like an older student can maybe take a group of younger students to the anatomy lab and show them things? Or no?
Yeah, for the lab practicals, it's only the teachers that can take the service of that. But since all the departments have departmental associations. For example, there's Boya Medical Student Associations. You have the people who are there. Normally, some of them sometimes the departmental associations organize tutorials to teach students some difficult subjects like anatomy. Some students may not understand, or people who haven't received. So sometimes the seniors organize those classes to teach the students for free.
Okay.
Then most of the students in that who are part of the association, the seniors, you can always meet them to ask any question you want. In the hospital, it's even more practical because for every patient, there's a 4th year, a 5th year, a 6th year.
Wow.
Yes, for every patient.
Okay.
So you can always consult with
the older students.
So it's very practical. You can always have access to senior students.
Okay. Is that your experience too, Dr. Ayafo?
Similar but a bit different.
A bit different. How is the setup then?
Well, I'll say in my own situation, we were mostly in charge, the senior students were mostly in charge of the patients to do all the work. And you really didn't have maybe other people to look up to. Yes, they put you in charge, and if you have challenges, you go to your consultant. So you're just with your classmates. Yes, it can be 3 of you, they put you in groups, 3 of you in the same class. Yes, you work on the patient, you come out with your clacking and your presentations and everything. And then if you have challenges, once you've presented to the consultant, he can clarify you. But we weren't paired with junior students or senior students, so it was a bit more challenging, just us rubbing our brains together, sharing ideas, no senior students to look up to. Yes, so then we push through. And the good thing is you still get to work in a group. At least you're about 3 or 4 of you.
And before you go out to the physical hospitals, how do they have a lab in school? How good is it? And
yes, we have a lab. We had a lab, an anatomy lab, as Dr. Besson said. We had an anatomy lab. We had a microbiology lab. The anatomy lab is where there were dead bodies. We started from there. You have to dissect. You have to, have a view and study all the bones and everything. And it wasn't it was not an easy experience, It was quite challenging. Sometimes you go home, you find it so difficult to eat when you reflect on those images and the smell, the chemicals that were used to preserve them, the formalin and all of that. But you have to be able to be tougher than that. You make up your mind that, okay, this is important, it's necessary for me to learn. So you build that shield, that tough shield, and you learn, and you see a day at a time. Before you know it's over. So that was one of an ugly experience that I didn't really enjoy much, but I did it because it was important and I went through. So yes, the anatomy lab is there, the microbiology lab, you go, you test, different tests, microorganisms, and yeah, so that also helps you so that when you're now in your professional field, it helps you to be tough, it helps you to be able to be ready for the challenges ahead, and it helps you knowledge-wise too, even if you're not going to be working in the lab, in the microbiology lab. When a lab technician, you have results, you're able to know what you're dealing with. Yes, you have the knowledge because you've learned while you're still in school. Yes, so institutions that have all of that, yes.
So I'm going to ask a very funny question. It might sound silly, but we are in Africa. So for somebody to go through the medical school, you have to work hard and smart, and it's a lot of work. And you need cooperation and groups to study groups. And so can you have like a good position, maybe your parents are rich, can you buy your way through medical school? Or relatives, maybe your uncle is one of the lecturers, can you get your marks, your points like that and go through medical school?
I haven't heard about it. I didn't do it, so I don't know. I don't think it's possible.
I believe in hard work.
I
doubt.
I
You doubt
I doubt
it?
it's possible.
Mhm.
I don't know.
So if somebody is graduating, they have put in the work.
Yes.
Because you write a conclude to enter another conclude to go out.
Exactly.
Yes, you write a conclude.
Yes.
In the CTA,
Yeah.
you write a conclude.
Really?
The national conclude. So,
Oh, I didn't know that.
I had to take an international exam in our school. You write 2 before you're going out. Yeah, you must pass them. That's the criteria. Yes, the IFOM, International Forum of Medicine. I mean, you must pass it. Unless you pass, you're not going anywhere. So it makes it very tough. Yes, to make sure that you really warrant that degree. Yes, before it's handed to you. No buying and no easy exit.
So, what I've gathered, secondary school, you start working early. Secondary school, you need biology, maths, physics, and chemistry. High school, you need biology and chemistry, but you still have to have good knowledge in physics and maths. Then you write an examination. You can do preparatory classes, or you can get the information and study on the syllabus and study on your own, and it's possible to make it. So even at the point of entry, you can still make it without knowing anybody.
Yes,
Very possible.
very possible.
You can still make it without giving a huge envelope.
Yeah, definitely.
Okay. And then during the school time, it's challenging, but it's possible. Study groups, and the first 3 years is easier, although it's increasingly getting tougher. But at the 4th year is when you really get to feel it. And in 7 years you're through. Let's talk finances. Can somebody whose father is I won't say farmer, because we have farmers that are industrial farmers, they are rich. We have farmers that are really they are doing very well. But if somebody's parents, they're doing subsistence farming, little farming, or they are traders, can this person attend medical school?
Yes, they can. In Cameroon, they can.
School fees,
Yes.
photocopies, books,
Yes.
do they need computer and
Not compulsory. Not compulsory. Not compulsory. They can print out the handouts.
yeah?
Yes, it's, in Cameroon, fortunately, the fee is same.
It's how much?
50,000 francs.
50,000 francs flat.
Every next year.
Okay. That's added to registration though.
Yes.
Do you register every year? Just the first year?
The first year, so 10,000 francs.
Yes.
Yes. Then after that 50,000 francs per year. Yes, and the government gives 50,000 francs grants. If you have, I think a GPA of 2 and above, or 2.5. 2.5 and above, the government gives
2.5 and above.
Yes.
You have a grant of 50,000. So it's paying your fees.
Yes.
Basically.
Yes.
Exactly.
The second year.
From the second year, the government gives grants, like you're receiving back your school fees, your tuition.
Because you are doing well.
Yeah, but you have to
Oh
have
my
an age
God.
limit. That's for 25 years below for undergraduate.
Yeah?
I don't know for some postgraduates, but for undergraduate, a GPA of 2.5 and above, age limit 25 years.
And under.
Yeah.
Okay. Wow. So basically, that's amazing. That's a good thing. And I haven't heard about that before now. Wow. And then, wow, okay. So even if your parents are not doing well financially, it's possible for you to attend medical school.
If you are able to pass the government entrance exam,
Yeah.
yes, if you are on the condition that you are able to pass it
Yes.
and get into the government university.
In the because the private ones are more
Yes,
more
the private is a completely different
thing.
yes, scenario.
Okay.
You spend millions there. So that's why if you're aspiring to get into the medical field, you should start preparing well ahead of time so that you have that opportunity, that chance to be able to find yourself, passing the entrance exam, because it will save you a lot. That's when you spend little or nothing.
Yes.
Once you've passed, then you get your grants and you're paying just 50,000 francs. Otherwise, you will be spending a lot in private institution if you're not able to pass the entrance exam or write the entrance exam or get into a government institution. Yes.
So Cameroon, to get into the private institution, you must still write the exam.
Yes, you must still write the exam.
Yes, but you cannot choose. You can choose, I'm sure, either you go to government or private, first, second, and third choice. Is that how it is?
I didn't get to know about that.
No, you're filling the form. You have to put your choice of the faculty you want to do. Either FHS Boya, FHS Douala.
Yeah.
Yes.
We
So you choose.
But the fee will be different. In a private institution, the fee is different. So, but if you're fortunate to be in a government university,
then it's subsidized.
yes, but usually the position is limited.
Yes.
There are very few, so you must push yourself to be among the few that can be selected.
How many medical schools do we have here in Cameroon? I mean, government. How many government centers? I know of Q's and I know of Boya.
Douala.
Yeah,
There's one in Douala.
There should be four.
The Chairman is there now.
Yes.
I know there was one in North. I don't know if it's now. They're opening the very good.
So we have about 4.
Bamenda.
There's one in
Yes, there's
Bamenda.
one in Bamenda now recently.
No, that means there should be more than 4.
University of Yaoundé, University of Bamenda, University of Douala. There's a UDM Bangante, there's ISTM, there's Khalid University in Congo, there's University of Changnan. They're currently doing the defense for the first batch of medicine.
Okay.
That's the other ones that.
So
But the Catholic University is not government, yeah?
No.
So we need to check the accreditation if they do have that before we register.
No, they do.
Have what?
The accreditation.
Accreditation.
Recently.
Yeah,
they graduate.
Yes.
They do. They initially closed, but now they do.
Okay.
Yes.
All right.
So
there's much more options.
Yeah,
And even if you're just speaking English, you have more options more than University of Boya.
Yes, you do.
Okay. I came here thinking it's either French Q's or English.
No,
University of Boya.
when preparing for the concours, to register, they'll give you a form to choose which institution you want to go to. If you want to go to Douala, you want to school in Bamenda, but you have to choose your center where you write and the faculty you want to school under. So you have those choices to choose among. That's what you do.
Okay.
But you may choose those two things and they will post you any school
Any
of your choice.
direction.
So you can write everything and you'll be posted to Kali University, which is 1 million francs. Yeah, so you may choose Bamenda, choose Mena, you choose Kali University. So yeah, so you may, like I think I chose Q's and I chose Boya. Q's was my first choice. That was posted to Boya.
Okay.
So a lot of people choose Q's and posted to Douala, which is government. So.
It depends too on the numbers they already have. Maybe if one place is full, then
Yes.
they will take the next people.
Also the
And,
division.
Yeah.
yes.
Yes.
And
Okay.
the division, they do it in such a way that it's not a matter of bias, not like there are only Anglophones in
Regional balance.
yes, they do regional balance.
Okay.
In every faculty there are Francophones and Anglophones mixed
Okay.
together.
Okay.
Yeah, that's right.
Wow. All right.
Generally,
And
there's
then-
hope.
There's hope there.
There's hope. You
It's
pray
sounding very hopeful.
to find yourself in an institution where you pay less,
Wow.
less money, so that you
Okay.
won't have to struggle, financially, doing your medical program, your
Alright.
medical degree.
So the degree here prepares you. Is it recognized in Africa? Do you know that in other places in Africa?
Yes, international is recognized.
Yeah?
Yeah.
Okay. All right, that's awesome. That's awesome.
And I think there is a body where you have to, in Cameroon, you have to submit your documents for them to recognize
To evaluate
Yes,
it.
evaluate. There's a board.
Sure.
Yes.
most times there's no problem to study abroad country. After studying in Cameroon, a lot of our seniors do their masters abroad, specialization abroad. Yes. You just need to confirm. It's not very complicated.
And you studied in the Gambia.
Right.
They speak English there.
Yes, they do.
All your courses are in English.
Yes, all my courses
were in
English. Fortunately. Yes.
Is that private? Is that a government school? Is it US sponsored? What is it?
It's a private institution that's following the American curriculum. Yes. So you have most of the consultants they speak English, but the natives of the country they speak Wolof. Yes. So if you want to study there as a student, you should be able to speak at least a level of Wolof. You should be able to have a basic, because you will have to be interacting with them. But your courses will be taught in English. Just that the patients will not understand English very well. So you need to know a certain level of Wolof to communicate with them, to help them know what you're trying to make them do or what you're explaining to them.
Yeah.
So you have to go the extra mile to learn the language, your local language, a little bit.
So did you have to pay fees as an international student? Or you did?
Yes.
You paid as international student?
Yes, I did. We all had to pay fees as international students, and it was really expensive. It's a whole lot of sacrifice. But at the end of the day, look at what you're achieving, and it keeps you going.
And if somebody from Cameroon, for example, wants to attend school there, maybe they wrote this concours in Cameroon, they did not make it, but they don't want to wait for next year. What do they have to do maybe to apply for that school? Do they have to register, then go there and take an examination, or what is the process? If you still remember.
Yes, you have to apply. When you apply and you're accepted based on what you've studied, just as she mentioned. When you look at your transcripts that you've done, your maths, physics, biology, the basics, and you have good grades, you can accept your application, and when you go there, you still take an exam. Yes, for you to be placed. You don't just, it's not a direct entry. Yes, you still take an exam. I had to do that. Yes, I had to take an exam, so it's a prerequisite.
And when you graduate, can you practice? This school is linked to the US. In what way?
Well,
can you practice there, or you cannot?
You will have to take,
or you have to go through a process like every other person.
You will have to go through a process like every other person, but the advantage you have is that there's an exam that the Americans take, the USMLE, United States Medical Licensing Exam, and the school is registered. They have the opportunity, they've been given the right to register the students for that exam. So that's the upper hand they have, which the government university doesn't have. So if you're a student in that school, you'll be able to sit in for your USMLE that can permit you now to practice in the US.
If you make the exam.
If you make the exam.
Okay.
Yes.
All right. I'm not sure if graduating from our schools here, students can also apply for this examination.
Apply, but you're not right in Cameroon. Most people have to travel to Ghana
or South Africa.
So it's a possibility.
Yeah, but the centers are not in Cameroon.
Actually, there are about 2 countries with centers.
You know, then the Gambia is involved.
Okay.
Well, there are institutions in Cameroon that they have been able to register their
students.
Yeah, their schools. And then There are some that have not yet, but you should look it up. You should look
as
it
an
up.
individual.
Yes, as an individual, you look it up, and then you see all the list of schools there.
What exam is it again?
The USMLA, United States Medical Licensing Exam. Yes. So
Okay.
when you're able to do that.
Unfortunately, we are talking about brain drain, but at this point, we still have to talk about it. All right, so Dr. Benson, you've graduated and you're working. Is your expectations before you graduated and the actualities on the field, are they matching? Because before you graduate, we all know you were thinking, see yourself, doctor, blue pen, white coats, all clean, down the hallway, enjoying.
And I've always told you that the pen down the hallway, it's not easy, right? So I think concerning the expectations, when we're writing the concours to get into medicine, well, the government of Cameroon was doing direct integration, where once you get done with your medical studies, you are directly posted to the hospital by the government. But as of 2020, the government stopped directly recruiting doctors. So you need to write a concours to be recruited, where you take short 50 people per year. So I think that's one of the challenges.
50 people
per year.
in what part?
50 doctors, medical doctors.
In the whole of Cameroon.
Cameroon. So when we're entering, we knew it's going to be direct. But while there, the laws changed. So I think that's a surprise that most of us had. But it's a professional course, so no hope lost. So we stepped out of medicine school. We can now write the integration concours, or you can apply to work with the private sector. So that a lot of private sectors are recruiting, so people can choose to follow their studies. Since it's a flexible field, you can decide to teach, you can decide to do masters in any course you like, and that's how we're doing. So we thought it's going to be very easy. Now it's difficult but not impossible.
Yes.
Yes, there's still some openings, and there's still a lot of things that we can do with a degree. So I think it's okay.
All right. After all these years of practicing, do you think you chose the right career?
Yes. I think
you still enjoy it?
I still enjoy it. Yeah, the one thing I love about medicine is that I used to have the passion to see someone taking a drug, moving from a sick state. Maybe you're feeling feverish, you're feeling cold, you've lost appetite, and you take a certain medication. I like the miracle that transforms the person from being sick to being happy. So it is something that I love to see, and I really like it.
Okay. It satisfies you?
It satisfies me. This is somebody who was initially sick and down and found a person jumping and running. It gives me a lot of joy.
Is medicine nasty? Is medicine nasty? Wounds, blood?
No, I will not really say it's nasty. It's just a matter of procedure. You know, it's about training. Once you've been trained, you know how to handle. You know, you need to protect yourself first. You need to sterilize the environment. So once you do those things, it doesn't really make it very nasty and scary. Yes.
How is the pay?
I think
is it like what you expected? Is it below? Could medical doctors be paid better?
I think it's enough to survive in Cameroon, and the advantage is that it's a flexible profession. Like I said, you can still get into teaching, which can add to the income you have.
Where can you teach?
You can teach in a lot of you can teach in universities. Yes. So if I do a master's, I can teach in universities. I can teach basic health sciences. So it's flexible. So you always have something you can do to add on your salary.
Yes.
Yes. So I think it's not bad.
Okay. Do we have specializations in Cameroon?
Yes, we do. The specialization in Cameroon, you have two main centers, I think. University of Yaoundé and now University of Buea. University of many specialties of anatomy disorder.
Yeah?
Yes, you have surgery, obstetrics and gynecology, pediatrics, dermatology, public health. There are so many. While University of Boya has, I think, 2 for now, obstetrics and gynecology and emergency medicine and anesthesiology.
Okay.
So most of those specializations take 4 years.
4 more years.
4 more years.
Okay. Do you have to have practice before they accept you for specialization? Can you go straight from graduation to specialization?
As of now, I think yes. I think yes.
Okay.
There's even an opportunity to move from the CDN to specialization. They call it internal.
Okay.
But when you're done
Like an
graduating,
internal transfer.
yes, when you're done graduating, you can specialize. The only thing is, if you're not recruited by the government, if you've not passed that computer in Machuku, you may pay higher than people who are already government, who are in Machuku in the government.
Okay.
Yes, always pay higher.
All right. Doctor in training, Miss Abo Leticia. So you are in school. What are your expectations? Are you expecting what are you thinking will happen after graduation?
Actually, when I got into medical school, I was having that joy, knowing that I'll be integrated after I'm done with the training. But when I got to realize that the government is no longer posting, I started looking for other means, like thinking out of the box. If I should specialize out of the country, if I should do something else. But as from now, after I'm done with my training, I'm hoping to further my studies abroad.
Okay.
That's what I can say.
All right. And what are your plans? Even before I ask about your plans, I seem to have the idea like we have shortage of doctors in the hospitals here. Why? When we have so many doctors graduating, why do we have shortages?
Because they're no longer being posted by the government. So, and there's just a certain amount of doctors, number of doctors that can be in one hospital. So it's already there.
Not if they have shortage. Because from my going to hospitals, I really think they have shortages. Sometimes one doctor is not there, you have to wait for them 1 hour, 2 hours. If they had enough maybe, and maybe 1 or 2 on call, they could easily address that issue instead of the patient waiting for 2 hours. So, and on the flip side, I feel like it's a lot of doctors that don't have jobs. Yeah? So I'm wondering why we are graduating a lot of doctors and yet the hospital situations is like it's not enough doctors to, because it's a lot of sick people, Yeah. So I guess that's something that's out of our control.
Yes,
It's out of our control. All right. And what's the plans for you, Dr. Emilia? Future plans? Any future plans? Specialization? Anything like that?
Yes, I have a lot of future plans.
All right.
I haven't stopped learning yet, and I'm also interested in adding other beneficial health programs to my degree. Recently, I started a course in project management, which will help me in any position I find myself to be able to handle projects well. And it's a good boost, it's a good addition. Widens your scope, your reasoning, and also I'm thinking of public health to add to it, so that it can also expose me to more opportunities. Because just as Dr. Bessie mentioned, right now you have to be aware that the government is not going to place you somewhere. So it's left for you to take upon yourself to build yourself more and you'll be able to have more opportunities. Yes, so that you're not limited, you're not stranded. You can be anywhere else and not necessarily only in the hospital. If you're a public health specialist or you're doing a project management, you can pick up a project management job somewhere which is health related, and you can work in diverse organizations. So right now that's what I'm doing. I'm building myself more. Why also looking at opening to get maybe into a hospital and start practicing as a general practitioner for now. Like taking the concours that you have to take for it to be recruited. So those are the plans now.
Alright.
Trusting for the best.
So, for us to round up, all in all, it is hopeful. Would you guys advise the younger generations, the children, the youth coming up to join this profession? If that's what they've been thinking about, would you say yes? Think about the money, the work schedule, the intensity or the workload. Think about all those things. Would you advise them to join this profession?
I would say, honestly, just be sure of what you are getting into. If you're convinced that you want it and you're ready for it, then go for it. I wouldn't tell you go or don't go, but know the reality. It's a whole lot of work, a lot of determination, dedication, a whole lot of self. You have to keep yourself aside, Lord, and sacrifice. Just focus. Yes, it's not playing something. You must be ready for it. And when you start practicing, know that you have many hours of work. If you are a woman, for us, the female doctors, you think of family, childbearing and all of that. If you know you'll be able to balance it all, then go for it. If you know it's not your time, you won't be able to meet up with all of that, then don't go for it. But in all, the medical field is a noble profession. It's very noble. Being able to attend to a sick person, as Dr. Besson mentioned, and seeing the person get better, being able to intervene in situations that make people feel relieved, it's a blessing. It's a blessing, and you're helping humanity a lot. What God expects from us, so it's very noble. Yes, comes with a lot of challenges, but it's noble and it's rewarding. So I wouldn't say don't go, but just be ready for to know what you're getting into.
It's challenging.
Yes, it's challenging. Right.
Okay. And what did you say, Dr.
Nyamba said almost everything.
Yeah.
I wanted to just say it's good that if you want to get in the medical field, get somebody you trust to place everything that involves in front of you. And if you really choose if this is really what you want to get to, because it becomes part of you, becomes part of your life. It's not just a job, it becomes part of your DNA. Yes, you sleep and dream about patients. You sleep and remember that you have to give paracetamol to one person. So it becomes like the patients become part of your family. Yes, so you need to be able to welcome that calling. Yes, you're ready for that calling, that sacrifice.
It's funny you call it a calling.
Because
It is a calling.
It is.
All right. Any other contributions? Any other thing we could say that was not?
My doctors have said everything.
Okay.
I'm good to go.
All right, good. Do you feel more confident now?
Exactly.
All right. Our dear audience, we have come to the close of this conversation. It's amazing. I've learned a lot of things that I didn't know up to this point about the medical field. I'm so happy and opportune to be here with so much brain. Don't mind that they are sitting and keeping their hands like this, yeah? There's so much brain power in here right now. So what is important to note is just with your smart and hard work of studying, dedication, discipline, even if your parents are not rich, in quotes, like they just live from day to day, they can afford very little, you are able to write the concours for the medical school and to go through the program successfully. So you don't have to be a rich man's child to go to medical school. And you don't have to have an uncle to pass the concours. We have testimonies right here. And the medical field, as much as we are graduating, the government is graduating them, we have part of them that will go further to study abroad or here. We have others that will go abroad to work, and we are constantly in need for more doctors, just as in the case of nurses. So it is a field that is always open. There are always different possibilities. You could work in hospitals, you could work in the ministry, you could work with different departments, social departments and things like that. There are many, many opportunities, and as you've heard them say, even with their experience, even with the challenges that they had during school and post-school, they are still able to say it is a noble profession and it is a calling. So if that is your calling and you feel it tugging, go for it. Don't be discouraged. If people around you are negative, don't even discuss it with them. Put your head down. Look for inspiring people like them. I'm sure you have people around you who have gone through this process. Talk to them and get the encouragement you need to go for it. So we'll call it a day. Thank you for watching, and look forward to our other episodes. And a very big thank you to all of you. Thank you for coming.
Thank you for having us.
Okay.
Okay.
Say good.